Now, the assessment that I am presenting to you is from the bank's completion report. 6 of 9 HSDPs have been completed. AP, West Bengal, Karnataka, Punjab, Orissa and Maharashtra. And World Bank reports summarizing the outcomes are available. The quality of these reports, however, leave much to be desired. It's interesting to note that no information is provided against many of the indicators set out in the original project document. And you find that these indicators for assessing progress become less and less detailed as you go on in years. Now, the AP project document has the maximum number of indicators spelled out, and because it comes up really short on many of these, I think there is hardly anything in the later ones. For example, on improved efficiency and effectiveness, very little is said in the completion reports. Many indicators have really no clear basis. You don't even understand what the definitions are. For example, increase in the number of admissions for pregnancy-related complications. We don't know whether it is as percentage of all women with such complications or as percentage of admissions to hospitals. And anyway, there is no data in the completion reports. Next. What exists, information that exists is on allocation to health as a percentage of state budget. Now, these have remained well below 5% in all 6 states. It decreased in 2 states during the period of the project, Karnataka and in Punjab, marginally increased in all the rest. Now, when World Bank funding will cease, these states are going to be in crisis. The percentage of health budget allocated to secondary and primary care is reported to have increased in 5 out of 6 states, but they say that it is of the total health budget without mentioning whether the total health budget includes the amount provided by the World Bank. Next. All HSDP projects completion reports mention a substantial rise in the total annual number of inpatients and outpatients in public hospitals, but no information on baseline data and no breakups given by region, etc. There is very little information on percentage of scheduled caste, scheduled tribe, women and BPL population in the increase in this. Share of institutional deliveries went up in Karnataka, in several states. But in each instance, this is share of institutional deliveries as part of all deliveries. The share of the public sector in institutional deliveries came down according to the bank's own data. In Punjab, there seems to be a drastic reduction from somewhere around 80% to 20%, and one really wonders, what has really happened? In Karnataka and West Bengal, 75% and more of the poorest groups are supposed to have used public hospital for delivery. But in Punjab, 80% use private facilities, and in Andhra, more than 50%. This is after huge investment in the infrastructure and in developing the facilities in the public sector. Usage has come down. Next. There is no information on improvement in quality of care at all, although it is one of the major objectives. There is a feeble mention of increase in client satisfaction without many details. What percentage of clients? Who were those who were satisfied versus who were those who weren't, and so on. And interestingly, an independent study in Uttar Pradesh shows decline in client satisfaction during the project period, steepest decline among the poorest, 40%. So just making a contrast that where there is an independent assessment, the findings seem to be slightly different. Next. The most successful of the activities seem to be collection of user fees, and these have increased many times, 10 times, 15 times, 20 times, and more. Next. In private sector involvement, Andhra Pradesh, they contracted out non-clinical services in all their secondary hospitals, claim reduced cost and increased efficiency, give no data whatsoever. But other objectives of regulation of the private sector, review of existing legislation, monitoring quality of care in private sector, mentioned as objectives in 5 states except Andhra. No mention of these aspects in the completion reports. Next. Even by the bank's own account, limited success in a few areas. What's worrying is the failure of the project to track information on salient indicators to assess project outcomes. This is not acceptable for projects of such scale. We have to remember this is loans which people are going to repay, and reports from the ground actually show that a lot of this may have gone wastefully in infrastructure development, that in institutions that are not being used, and so on. Now, considering that only 15% of India's health expenditures are publicly funded to begin with, the consequences of the success in increase in user fees is only going to be a major increase in the incidence of catastrophic illnesses, a human-made phenomenon. Now, even the World Bank, in its recent report, and the World Health Organization say that user fees are inequitable means of financing and should not be resorted to if there are other means of financing. Next. I just want to end. I had kept mainly to what the World Bank's documents themselves are saying, and it comes out very poorly. What is of concern is that there is very little available in terms of independent assessments, and we need to invest much more on carrying out these independent assessments of equity implications in service delivery, who has benefited, has access really increased, for which groups, and so on. Next. And in financing, what has been the consequence for cost of healthcare, for affordability? The few studies that exist say that cost has escalated, and how is the increase in health expenditure distributed across population subgroups, and how is public expenditure on health shared? Next. We need to assess what has the reform achieved in terms of improvement in quality of care, which is supposed to be one of its major objectives, which population subgroups have benefited and who the least, and has it really improved efficiency of health services? For all its claim for evidence-based policy making, I think there is little evidence of what policies it implemented were good ones to begin with, and now very little evidence that they have actually achieved what they set out to do. Thank you very much.